writing an operative report. There are right and wrong ways to write an operative report. So you may have written an op report previously. However, you may not be writing it correctly or including the correct information. A surgical record is not an operative report. A surgical record is strictly in point form almost, or in some kind of a tabbed format or slot format, checkboxes, etc. And that is not acceptable documentation for a surgical procedure. So when you're writing an op report or dictating an operative report, remember again who is reading it and that they must understand and be able to interpret it. It will be read by somebody in medical review, a physician or a nurse. You're going to be using anatomic, not dental landmarks when you're dictating surgical site, location of incision, the length of the incision, etc. The operative report is written on plain white paper, not on letterhead stationery. When you look at the cross-reference of dental landmarks to anatomic landmarks, you can see they're the same that you're going to be using for your LMN, the same that you're using in your head and neck evaluations, etc. So you're going to always use the anatomic landmark and not a tooth number, whether it's in the maxilla or in the mandible. When you are dictating or writing an operative report, the heading will simply state operative report or report of operation. It will be followed by the title, patient name, and when you state the name, the surname is stated first, followed by the given names of the patient. The next heading is the date of surgery, and that's self-explanatory. Month, day, and 4-digit year. Chart number, and that's for hospital procedures only. Under the heading surgeon, you're going to state the given name, then the surname, followed by a list of all professional degrees. For the preoperative diagnosis, we need description only, using medical terminology. No codes are stated on an operative report. For the postoperative diagnosis, if no other problems were discovered during the surgery, simply state same. For example, if there were other problems discovered during the course of the surgery which required surgical intervention during the operation, you would state same with addendum diagnosis. So for instance, let's say you had a situation where you had a sinus perforation or an oroantral fistula. You would indicate same with addendum diagnosis, oroantral fistula. Under the heading procedure, again, no codes, description of the procedures performed from the most important to the least important. Under the heading anesthesia, briefly describe the type of anesthesia used. For example, nitrous oxide analgesia with local with oral premedication, etc. Under the heading medical history, and this became a requirement where an ICD-10 went into effect. Under the medical history heading, provide a brief but detailed medical history of the problem being treated. State only information that is relevant to the surgery that you're performing. So for instance, if the patient is taking over-the-counter vitamins, minerals, whatever, that's not relevant to the surgery that's being performed or the treatment that's being performed. So you leave that out. If the patient's medical condition is relevant or the medication they're taking is relevant, then that is stated. So you want it brief but detailed. So here's an example. Maxillofacial CT scan revealed severe atrophy of the mandible bilaterally with healed pathologic fracture of the left mandible. Exposed mental nerve foramen at the superior border of mandible. That's it. Patient has no other medical issues, is not taking any medications. That's all we need to state. Keep it simple, sweetheart. The old KISS rule. Under the heading operative technique, this is where you describe step by step the surgical procedure. from the pre-medication to the location of injections, incisions, etc. Blow by blow, step by step. Nothing should be omitted. Remember, this is a legal document. It can also only be prepared by the doctor. You conclude with discharge instructions, including prescriptions given, dosages of medications, how to take the medication, and then indicate when the patient is to return for follow-up visit, suture removal, post-op care, etc. For the signature, the doctor's name is stated simply as Dr. John Doe, surgeon, with a line above it for the doctor's personal signature. No one can sign the op report for the doctor. If the op report is dictated, it can be electronically signed by the doctor, and it would state the following: electronically signed by Dr. John Doe, surgeon, on, and the month, date, and 4-digit year. It would then be attached to the electronic health record. Templates for all the op reports are all in section 6 of the Z-book. Also, they are on the template CD, ready to edit, save to your patient's electronic health record, digital chart, or print out and submit with your claim by fax to medical review. There you see section 6, the index in the Z-book, operative reports, and actual op reports, so that you can see how successful dentists, successful offices write their op reports for the type of reimbursement that you can expect if you follow the template. You also see there an operative report template for removal of impacted wisdom teeth. This is what all the templates look like, both in the Z-book and on the template CD. Anything that is in capitals, where there's a blank or in red, requires that you edit it, specifically customize it to your patient. When you're dictating an operative report, and we recommend Dragon medical dictation software, then all you do is follow the template. As you're dictating, the op report will come up on the screen, and you'll see exactly how you're dictating it, and then you can edit it for any corrections in spelling or pronunciation or whatever. But make sure, if you're going to use dictation software, that you purchase the Dragon medical dictation software, so it recognizes medical terminology, anatomic landmarks, etc.